So insurance has a lot of lack of transparency. You don't really know everything that they cover, and it's always a surprise, like, oh, that's another charge. The great thing about taking insurance out of our relationship is now there's not someone between us. You know, we're not waiting on the prior auth, or you have to figure out your copay. It's just, you know, the price up front. It's you and me discussing together. You're not going to have to pay for an extra visit. That's covered. And no copays. You've paid your membership, it's included. It's not an option for me anymore. It's so important that I'm willing to do this because it changes who lives and who dies. With direct primary care, it's a membership model where you pay me, but you don't have any copays. And you know, your annual physical, well woman exam is included in that. The great thing about taking insurance out of our relationship is now there's not someone between us. You know, we're not waiting on the prior auth, or you have to figure out your copay. It's just, you know, the price up front. It's you and me discussing together. What I've seen during the pandemic specifically is people who had insurance were less likely to see their doctors, and therefore less likely to receive necessary routine care. The fear is the cost, the copay. What is it going to cost me? And the fear of the unknown. So insurance has a lot of lack of transparency. You don't really know everything that they cover, and it's always a surprise, like, oh, that's another charge. And so the fear of cost is real. One of the things that a lot of people don't see is the average primary care practice has 4.5 administrators for every single doctor. The average direct primary care has 1.5 administrators per doctor. So it takes a lot of the middlemen out and allows us to have the time. So by removing all of those administrators, that's a lot of overhead that we don't have to carry. And that means I can devote the time that would be to documenting for the insurance specifications, sending all of the authorizations through them, all of the notes, and then waiting, and you're waiting, can we do this? Is it approved? Not only do we cut out those administrators, but also the time it takes to do that. So then I'm able to spend more time with you, and you're able to have more time discussing things that are important to us, like why we want to do this, if it's the right fit, what are the side effects, do you really want to make these changes, or is that worth it to you? And simply being able to have that extra time, I don't view as extra, I view it as necessary for providing good quality care. And we know that the more time we're able to take with people, the better care, and we've proven it. Studies have shown that physicians often don't talk about lifestyle because they haven't been trained, or because they don't have time. And so in this model, we're able to bring you both of those. I'm going to bring you time and access, and I also have the training to be able to talk specifically about the data and how you can use it practically in your life. It's not an option for me anymore. It's so important that I'm willing to do this because it changes who lives and who dies. The inflation for healthcare, shockingly, but we all feel the pain, has gone up over 47% since 2011. And the earnings have only gone up 31%. And instead of the insurance companies paying more for you, they've pushed that cost to you. So now the average family pays about $22,000 a year in premiums, while also having less access, and I would argue less quality, because they're not able to get what they need. And so I want to be able to take that out of the equation to a certain degree, maybe not eliminate it, but really bring that down to a manageable place with better access and better, if not equal, quality. The monthly membership fee will cover your annual physicals, and you're never going to have a copay. And I'm not going to limit the time. I'm not going to say, oh, you ran out of your time. Sometimes if things are long, we'll need extra time, but you're not going to have to pay for an extra visit. That's covered. And no copays. You've paid your membership, it's included. Cost savings can be immediate as well as in the future. You're basically paying yourself in advance, right? If you're able to be less sick now, maybe get off some medications, achieve some of your goals. That can also reduce your risk of spending more money down the road in terms of having a heart attack or colon cancer or breast cancer recurrence. So, those changes now that we can help you make not only have cost savings in the future, but will help you have less disability, longer life, and be more active. And so it is about cost, but it's also about the life you want to lead and what it looks like in the future. And the next is through steeply reduced medications. We will offer a formulary of over 1,000 medications, which will be included in the membership package. So that's a huge cost savings to you right there. And if we don't offer it as part of the package, we'll help you find ways to have reduced cost. And there are many ways that we can do that, whether it's finding assistance programs or just helping you figure out where to go to get the best cost. In addition, we've arranged cash pricing with some other facilities for the best price for you. And if you still have insurance and we can use it, well, we'll figure that out too, because we want to be able to tailor your experience based on what's best for you. An average follow-up visit for a patient of my direct primary care minimum is 30 minutes. I don't schedule any appointment less than that because I think that you deserve the time, and I want to make sure that we can hear each other and make decisions together. When establishing care with me, whether it's for a lifestyle medicine consult or for joining the direct primary care, we block 60 to 90 minutes of time. It's important to do that because we need to make sure that we're able to explore your history, your goals, your physical exam, and to be able to make the plans for the future together. I want to be able to provide health care, not sick care. Our current healthcare structure is built on diagnosing illness. I want to flip that paradigm. I want to help you build health. It's not that we won't talk about disease. It's not that we won't treat it. That's going to happen. We live in a world where things can happen, and even reducing risk doesn't eliminate everything. So the more healthy you are, the less likely those things are to happen. And we know how to do that. The science is very clear how you can build health. Make yourself less likely to get severe COVID, less likely to get a heart attack, stroke, and cancer. We have the data. What we don't have is a good structure for us to be able to help people do that. And so that's why I've done this paradigm shift here, so we can focus on the things that help you live longer, live better, less disability, and are happier. And to do that, we had to shift the structure. And that's why there's a teaching kitchen behind me. That's why we're going to talk about how to implement those things in practical, doable chunks that can build up over time. Small changes can have long-term differences. When you think about investing, your health is like that, only even more so. And so by flipping that to focusing on building health and relationships, we're able to plan for the future and to see that it's a good future, not I'm going to look forward to being in sick care. And so sometimes you need places where it's focused just on sick care. I've utilized those, I've practiced in those, and those are certainly appropriate. But in your day-to-day life, when you're working on building health, having a paradigm where health is the focus and we work on building that and dealing with other things as they come along is really what you need to have long-term success.